Good evening, everyone. It's Dr. Hennessy. I wanted to touch base with you before week 3 and give you a little bit of feedback on week 2. So I know there was a couple questions and some things to address, so I wanted to go ahead and do that here via video before you guys jumped into starting week 3. So week 2, all of your discussion questions should be submitted at this point. Obviously, the initial posts were due on Tuesday and Thursday, and then all of your responses are due by tonight, and the assignment is also due tonight. So I know that you'll see on the calendar it says 2 a.m. like the following Monday morning. That's because we're on Central Standard Time. So it's technically due at midnight on Sunday, if that makes sense. So you guys have until this evening or tonight at midnight to submit Central Standard Time. So one of the questions I got from last week was about calcium supplementation and what the correct age was to start suggesting that folks take any supplements. And obviously, you know, we all know from dietitians that you'd like to get, you know, these things from food, but not always possible. So if you do have a patient that you want to suggest supplementation for calcium supplements and folic acid supplements as well, for women of childbearing age, you want to start suggesting those in their teens and 20s so that they can get proper absorption. I usually like to suggest lower dosages multiple times a day because the body can only absorb so much at a time. So that is my recommendation for folks. Arthritis and rheumatoid arthritis. So I did get some questions, some emails from students that were really struggling with osteoarthritis versus rheumatoid. From an assessment perspective, is what most of the questions are for. You know, how do I kind of flesh out which is which? So when I'm asking patients questions that come into me for arthritis, one of the first things that I explore with them is timing of symptoms. So if I have someone that's telling me, you know, I get up in the morning and I'm super stiff, and then as the day goes on, I loosen up a little bit, the pain gets better, the more I move, the better I feel, and then the next morning it's the same situation all over again. In my head, I'm thinking this could be more osteoarthritic because a lot of times osteoarthritis is stiffer when you're not using the muscle, and as it kind of lubricates throughout the day, it feels much better. If I have a patient who's coming to me and saying, I feel pretty good in the morning, as the day goes on, I start declining. I'm sore, and it's in, you know, both of my shoulders or both of my elbows or both of my knees, both of my hips. When I hear that it happens later in the day after the inflammatory process has started to kick in on that patient and that it's bilateral, in my head, I'm thinking more rheumatoid. It's not to say that it couldn't be the opposite, but when it comes to timing and which one I put as my top differential, I kind of base it off of when their symptoms start and if they're symmetrical or unilateral. So I hope that answers the question about osteoarthritis and rheumatoid. For assignments and for discussion questions, I know that there's been folks who've just made some errors for discussion posts and whatnot. If that happens, you can always post under your initial post and make a note to disregard the previous post. For assignments, that is a process that I have to go through with resetting, that even if I do on my end, right when I get your email message, oh, my dog's in the background, disregard. My secretary back there. Yeah, I'm talking about you. But for assignment resets, if you email me and you say, I accidentally submitted the wrong assignment, or my mind map didn't attach, or something like that, just know that on my end, I usually address it right away and allow an additional submission, but that doesn't mean that it transfers over to your computer very, very quickly. So I've had a lot of people who are emailing me multiple times, and it's just that it takes a little bit longer to transfer over to allow for an additional submission because it's not the normal way of doing it. So if you want to make sure that you're submitting everything on time and that it's done right, just make sure you're double checking what you're doing and making sure everything goes. For mind maps, they do need to be attached to your initial paper, and you can always put them in there as an appendix. I'm fine with that. So if you want your mind map, or if you have two of them, if you want one of them to be Appendix A, one of them to be Appendix B so that it's still in APA format, feel free to do that. That's not a problem. I got a couple questions about that. Let's see. So I did have an interesting email from a student asking about kind of what the goal of this class was beyond the syllabus. And my answer to that really is that this pathophysiology class, although it is heavy in science, obviously, because we all need to know what's going on from a pathophysiological standpoint in order to be able to articulate some of these different disease processes, changes, variations, and deviations in a more English way to our patients. But really, we're asking you to learn about these diseases, and some of these diseases you know really well and some you don't, but we're asking you to learn them on a very cellular level so that when a patient comes in and you're in the clinic area eventually as you're practicing, when that patient starts talking about symptoms and they start talking about what helps and what doesn't help and how long that symptom's been going on and when it showed up and other environmental, familial, genetic factors, in your head, you're kind of coming up with an algorithm as to what that patient might have. So if I have a 49-year-old that walks in my office and says that he has abdominal pain, he's had bloody stools, he's had night sweats, he's had fever, and he's had weight loss for the last 6 weeks, in my head, because of what I know about pathophysiology, my top differential diagnosis is going to be colon cancer. Beyond that, I'm going to be ruling out Crohn's disease, from a physical standpoint, from a physiological standpoint, from a laboratory standpoint. You're thinking about these things, right? Colon cancer, you're going to think about Crohn's, you're going to think about irritable bowel, you're going to be thinking about GI bleeds, and you're going to be asking all sorts of questions to try to rule in or rule out various disorders. So in your head, essentially, as you're trying to come up with what might be wrong with your patient, you're kind of like an investigator, but you have to know all of the options in order to be able to diagnose that patient, or at least to know, this is where I'm going to start. This is my top differential diagnosis. This is my working diagnosis, and this is what we're going to do to figure out whether or not it's right. So if I have that 49-year-old patient in my practice, I'm sending them for a colonoscopy. We're getting blood work. We're trying to find out if they're anemic. I'm asking about a family history of colon cancer, Crohn's, irritable bowel, any type of autoimmune disorder. I'm asking about any other types of gut issues that people have had. Sometimes they know, sometimes they don't. I'm asking about anticoagulant use. I'm asking about, previous heart history or clotting disorders, you name it. So in your head, you're looking at all of these different things that you're learning in this class, and you're thinking, what is this? And then what do I ask my patient? So that's the other kind of bridge that we're trying to make, is from learning all of these things and knowledge of pathophysiology to bridging it to diagnosis and diagnostics in general. So a lot of times what you're going to hear from me as far as questions go is, tell me more about the timing of this, or, tell me what you would ask a patient to differentiate between these two working diagnoses based on maybe what you're saying in your initial post on the discussion board, or, tell me why this happens, or think about it in this way, tell me more about this. So expect those types of questions to be coming forth from here on out, because now we're trying to bridge. We've now gotten through the first 2 chapters, and now we're going to be getting into specifics. So this week it's neurology in the neurological system. So you're going to be looking at pain. You're going to be looking at body regulation as far as temperature and, various, sorry, my dog is like a hot mess right now. But you're going to be looking at different things that we need to know about when we're evaluating patients and we're trying to figure out what they have. So if I'm sharing my screen right now, if I'm looking up, at our introduction, we're going to talk about neurological disorders, and then, some of the respiratory issues that occur. The example is ALS. And then we're going to talk about pain. So our discussion question this week is focused on pain, which is a really hot button topic all over the United States right now. So I really, really encourage everyone to take a look at your state laws and find out how prescriptive kind of responsibility and changes are happening all across the US with the opioid crises. And, because you're going to be governed by these bodies as well. So very interesting stuff happening. There's a lot more education going on. And there's a lot of patients that are obviously very upset and need to be educated. So make sure you take a look at that if you have time. But we're going to go ahead and kind of take a couple different perspectives on this. So I'm always interested to see what students post in their initial post about this pain topic, because everyone's coming from a different background. Some of you have never been in pain management. Some of you are managing acute pain on a regular basis at the hospital. Some of you are managing chronic pain. So there's a lot of different perspectives, and this is usually a very interesting week as far as seeing the interaction and the different ways that people are addressing things, especially across the country. So feel free to query your colleagues in this discussion post and in this week. And I look forward to seeing all of the things that you guys come up with. So if you have any questions, please let me know. All of discussion question 1 grades should be in the grade book, and expect grades for week 2 to be forthcoming. Please remember that there are 3 separate things that need to be graded for every single student in all 4 sections of pathophysiology this week. So be patient with me. I promise I'm going to get your grades up before that 10-day mark. So everything, the finality of the discussion question and the assignment are both due tonight at midnight. So 10 days from tonight at midnight, expect to see all of your grades in your grade book. It might not be before that 10th day, but you're going to get them all on time. So be patient with me. I will be patient with you. If anybody wants to chat or wants to do a group meeting or something like that, please let me know. I think most of you, though, you have what you need. You're doing really well. I'm seeing good patterns. I'm seeing a lot of correction from week 1 to week 2. So keep doing what you're doing, and we will talk to y'all soon. Have a good week, everyone.